welcome to this webinar around the Health and Care Professional Internship Programme, which is open and being offered now. So we are going to record, as Beth said, so we will record the presentation, then we'll stop recording and we will do a Q&A. So if that's okay with everybody. So without further ado, as they say, I'm Julie McInnes. I'm a researcher at the University of Kent and lead for this programme. And with us today is Beth Flowers. So Beth is the co-lead for this programme at the University of Kent. We've also got some of our advisory group, steering group members on the call. So again, we don't have a huge amount of time, so I won't introduce everybody, but again, thank you for your support as well on this programme. So if I just start off. So the Health and Care Internship Programme, what's it all about? So we provide funding for health and social care professionals to advance their knowledge and skills in research. So the internship is aimed at a wide range of health and care professionals. There is an eligibility criteria, but I will come on to that a little bit later in the presentation. I think the key thing about the internship programme is that it's very flexible and individually tailored depending on your learning needs if you're thinking of applying. So you might just be new to research, or you might be a more experienced researcher, and it's to offer time, funding and support for you to pursue your research ambitions, as it were. So it's an NIHR, National Institute of Health and Care Research funded. So NIHR have funded particular regions across England. So in our region, this programme is delivered by the NIHR Applied Research Collaboration in Kent, Surrey and Sussex. So that's the sort of vehicle through which we run this programme. And that is a partnership between NHS Trust, Acute and Community, universities and other organisations who are involved in building research capacity, such as the Health Innovation Network and the Research Delivery Network. We also have public advisors, and I've just seen Michelle on the call as well. So that's who we are as a programme team. So here we are. So this is the ARC KSS Academy. So we are the small team at the University of Kent who have responsibility for research capacity building within this programme. So we'll give details of how to contact us in a minute, but that's who you will come through to if you have an inquiry or want to apply. So as I mentioned, I think, and this is a really important slide to take note of, it has quite strict eligibility criteria, which is unfortunately non-negotiable. So these have been set by NIHR, so part of the kind of specification for this actual programme. So you must be a registered health or care professional from this list of regulatory bodies. The programme excludes doctors and dentists. So that's the criteria. So Academy of Healthcare Scientists, General Chiropractic Council, General Optical Council, General Osteopathic Council, General Pharmaceutical Council, Health and Care Professionals Council, the Nursing and Midwifery Council, Social Work England, or UK Public Health Registration. So it is quite, sorry, Beth?
Sorry, there should be the medical and the dental councils on there for people who are working in those sectors, but not doctors and dentists.
Yes, thank you, Beth. Yeah, we need to amend that. So yes, so you could be GMC registered, but not a medical or dentist registered within that. So thank you, Beth. Yes, that's an important one. That should be on there. So in addition, in terms of eligibility, you must be at a pre-doctoral stage of your career, i.e. you don't have a PhD or other equivalent doctoral level qualification, or be currently studying a PhD. The other eligibility criteria is that you must work in Kent, Surrey and Sussex. So this programme is run across England through different organisations and regions. So if you're outside Kent, Surrey and Sussex, there will be this same opportunity or similar opportunity where you live or where you work. So one of the questions, so we've revised these slides based on sort of first time round. This is our second cohort. One of the questions we're quite often asked is I have no experience in research, is the internship for me? And the answer to that is very definitely yes. So the internships are for those with little or no research experience or knowledge or skills, right through to those potentially working in research delivery organisations and roles, and for those who are have greater ambitions to develop a clinical practitioner academic career. We are keen to seek applications from what we call underrepresented settings, or where we know that research is more limited. And those settings would include primary community care, local authorities, social care and research delivery. Having said that, the internship is not limited to those. But if you do work in one of those areas, we are particularly keen to hear from you. But again, similarly, if you're not in one of those areas, that's fine too, as long as you meet that eligibility criteria that I just mentioned. So what are we offering? We are offering 33 internships this year, and we will be offering the same next year. 10 of those places, so 10 out of the 33, are what we call ring-fenced, particularly for radiographers and pharmacists. And again, that is because NIHR nationally have decided that those two groups in particular are underrepresented in research, and they're particularly keen to attract radiographers and pharmacists. So a bit like I've just said about the community and primary care, for example, we are particularly keen to hear from you if you're one of those professions, but equally, if you're a different profession but still meet the eligibility criteria, we are still really keen to hear from you, because we still have 23 internships for people outside those two professional groups. So each internship lasts up to 9 months, and the financial envelope is up to £10,000 per intern, plus £700 for your organisation to sort of support the administrative costs of setting up and supporting your internship. And they may provide mentorship as well, which would be usual. So that's the funding on offer. I will just say now, because again, this is a question that still comes up. We don't fund you directly into your bank accounts, unfortunately. This goes through organisations, so we pay your organisation. But more about costings in a moment, which Beth will talk a little bit more about. We will be asking you to provide some basic costings, because we will need to do that to set up the internship. Again, we try and keep that light touch where we can, and we will offer lots of support if costings are something that's new to you. So the internship is offered at 4 different levels, so I wouldn't worry too much about these. Again, this is a criteria which has been set by the NIHR call, and it really just reflects the breadth of levels of experience that we are trying to attract. So we will be asking you when you apply to identify which of these groups you're in, or which of these types of internship, but I wouldn't worry too much about it. It's really just so that we can could somebody go on mute? Thank you. So this is really just so that when we report back to NIHR around the numbers, we have an idea of what level you are. So if you identify as somebody who you're in a clinical practitioner or another role, I mean, you have little or no research experience. So it's for you, if you want to take that very first step into research, to learn about what research is, how to engage with it, particularly, of course, this is an applied internship, so particularly around using research to improve professional practice and embed research in care. Some of you might have a little bit more experience. Perhaps you've done a research module at the university or other training course. You perhaps done a very small project in where you work, or you've been part of a research delivery team, for example. So you've got a little bit more knowledge and experience in research, so what we might call growing in research. But again, you need further support to advance that aspect of your career. But again, as I said, I wouldn't worry desperately about which category you are in. Just go for the one that sort of feels best for you. There's a specific category for delivery leadership in research. So those who are either in or aspiring to working in research delivery roles, to extend those skills. And we're really lucky that we have partners in the regional research delivery network as part of this call, who again can give support and advice for those of you who specifically want to work in those roles. Some of you may be aspiring to, as I said, this clinical or practitioner academic leadership. So you've got more experience of research and you want to develop your career around clinical practice, advanced research through universities as well. So again, that's the people who, you know, envisage a long-term career with a significant part of research as part of your remit. So what can you do as part of the internship? Well, in lots of ways, this is really, really positive because we anticipate you may not have a clear vision of what you want to do, particularly those who are stepping into research or growing in research. So as I said earlier, that the program is very flexible. So we've provided a menu of the types of things you could do as part of the application form. But I think the important thing to remember that this is bespoke and tailored to you. So you, if you like, come up with your own ideas around what you want to do. It's not meant to be prescriptive or exhaustive, that list. It's really just to stimulate ideas and open up possibilities. And again, we'd also urge you to talk to people where you work, perhaps if they're experienced researchers or mentors, to give you some kind of ideas and research and guidance in terms of what you might want to do with the internship. So these are just some visuals around those 4 categories. So stepping into research. So for example, you might want to undertake a taught module. So you could use the funding to do a module. You could attend a research ethics committee, or you could shadow an experienced researcher. You can potentially use the funding to do some public and patient involvement work. You could undertake a piece of work around an audit or quality improvement project. So it's really quite varied and broad. And again, if you've got good ideas as to what you could reasonably do in an internship within that small amount of funding and within that timescale, then again, as long as it's related to developing research and developing you as a researcher, then we would definitely consider all those options. So growing in research, again, some of those same activities, but perhaps at a different level. Keep pressing this thing, it keeps coming up weird. So delivery research, so those, again, this could be about conferences, for example, finding more out about clinical trials in your speciality, undertaking the associate principal investigator program, which again the RDN can give you more information around. So specifically for those in research delivery, and as I've mentioned, these are our clinical academic clinicians, practitioners who want to develop as a professional researcher, if you like. So the activities that you might want to do will go across these. So it's not that if you do one kind of type of internship, you have to do these activities. You can actually do all of those things I've mentioned and more across any of these types of internship. So what support will you get? So mentorship is clearly really, really important to develop research careers. So a mentor is normally an experienced professional, often someone who you work alongside perhaps, or they could be in another organisation. So the mentors will support you in developing your skills and knowledge. They might provide advice and career guidance, for example. They will help you develop research ideas. So mentorship is really important. Most people from our first cohort will identify mentors within the organisation. So there may be people you already know who could act as your mentor, in which case that £700 I talked about would be part of that. At ARC KSS, we do run a mentorship matching programme. So if you find yourself in a position where you don't have a mentor, then again, the ARC Academy can link you up with somebody in the region who could provide that role. But again, we can talk about those things if you're successful. So other type of support will be academic supervision. So some of you might be wanting to undertake an academic module or course. If that's the case, normally academic support and supervision is provided by the university or institution where you're doing that course. But again, if you feel you need an academic supervisor as parts of other types of internship, again, reach out to us. And we can link you up with someone to give you that academic perspective, perhaps, to your internship. Peer support is also really important. Research can be quite a lonely job sometimes. If you feel you might be the only person in your team or department that's engaged in research. So we bring together all the successful interns every month so that we can share successes and challenges, and also if there's any further support that you need. At the end of the year, the internships and partners we're going to be hosting an online celebration event. So again, you can share your experiences and support the next cohort of interns coming through. And we do have our first one of those coming up in the autumn. So I'm going to hand over to Beth because Beth will talk to you about timelines and some of the processes involved in the internship.
Thank you, Julie. Yes, so from today, the application process is open, and when this webinar closes, our comms team will be putting on the application form and guidelines onto our website, and we'll also be sharing this link as well to a link to this video. We need your applications by 5 p.m. Julie, this is the wrong slides. Just to mention, these are the old timelines instead of the new timelines. I think we might need to stop sharing, and I'll share my slides for just a second. Bear with me. Julie, would you mind stopping sharing for a second and I'll share mine?
We've updated the slides with the new dates, and then the fool in charge here shared the old ones.
Hopefully this one's the right one. Let's just bring that across.
We'll carry on with this slide set then, Beth.
Yes, please.
This is why we have Beth, you see, and this is why you don't leave it all to me. Everybody needs a Beth in their team to keep us on the right track.
All right, hopefully we have got the correct dates now. Okay, grand. Submit your application to us by 5 p.m. on 30th of September this year, not last year. That would be problematic. We need your applications to artcareassessacademy@kent.ac.uk. This is an email that is shared by myself and Teresa. We're hoping to get decisions out to people within 8 weeks of the application deadline. And then for successful applicants, we might be asking you to come back to us with specific queries if things are not clear relating to the application before we can go ahead with the award. Between you knowing that you've got the applications in successfully and being awarded the grant and starting your award, we'll be talking to your organisations and getting contracts sorted out. So the start date for the internships needs to be 1st of February to give enough time for contracting to happen in the background. And the internships are for 9 months. So this year, this round, they'll be finishing 31st of October 2027. And can I just check that everybody can see, you're not seeing all my notes, you're just seeing the timelines here? Julie, is that correct? Yes, grand, thank you. All thumbs up and hands up. Lovely. So complete the application form. It's not too long of an application. It shouldn't be too difficult to get through. Send it through to ArtCareAssess Academy. And do refer to the guidance. We've got quite a lot of comprehensive guidance for you to go through, as well as some frequently asked questions. But if you have more queries than you can get out of the guidance, then you can respond to us. The application form is attached on the link for this webinar here today. So when we circulate the recording and the slides, you'll be able to access the application form straight away. If you've got any questions about the application, do get into contact with us. We'll probably end up using our wider steering group, as Julie mentioned before, to put you in touch with somebody who can help you with your specific queries. So you'll get a named contact within one of the partner organisations to give you some extra help. And then after you apply, your application form will go in front of everybody else, alongside everybody else's application form, in front of a panel that's made up of experts, people on the steering group and public members to discuss all of the applications. Depending on the numbers that we have, the applications will be split out between different groups of people, but everybody will be looking at the same information to judge all of the applications. So personal strengths, the appropriateness of the activities and plans, Are you going to be sharing your skills and knowledge, and public community involvement and inclusion and inclusivity, to include patient public community involvement with your plans where appropriate? And as part of the process, we will be sending out an equality, diversity and inclusion questionnaire that's anonymous for you to respond to. It's not linked back to your application, but this is for us to keep an eye on and keep track on who's applying, and success rates for people as they go through. Now, I mentioned contracting. This is the agreement that will happen between the project ourselves, based at Sussex Partnership Foundation Trust, and the organisation that employs you to manage the money side of things, so that invoices can happen and that money is released for you and that you can have your time released to do the activities. So we do need someone who can talk to this, attached as a detail on the application form. Where we know your organisation and we know who deals with contracts, then we'll be organising all of those in batches, so that it's straightforward for our contract team in the background. But we do need you to name those individuals on your application form as well. And all of this takes place before the application, the internship actually starts. Okay, back to you, Julie. Do you want me to carry on sharing? And
yes, please. Let's not mess about with more slides. There's only 2 to go. So, so in summary, so I hope that's been useful. As I said, we have got time for questions and answer. But if your next steps, if you want to apply, first of all, check you are eligible to apply. So again, check that you're one of the registered eligible professions. You are pre-doctoral and that you're in KSS, Kent, Surrey, Sussex. As Beth just mentioned, start having those conversations early. So identify who you will need support with for your application internally. So for example, that could be your line manager. So if you're looking to spend some of that money for backfill or time out of your usual role to undertake the internship, then agreement from your manager will be needed. Think about, do you have a mentor in place? Because they can also help you, support you in the application maybe. And again, think about who you will need to name on your application in terms of your research and innovation teams or finance contacts, contracting, etc. So again, that should be clear on the form, but as Beth said, reach out to us if you're not sure. But so get your kind of contacts in order so that you can put them on the form, because that sometimes can take a little bit of time. So I would say you start thinking about that now. Think about which of those 4 levels of internship best describes your research experience: stepping into research, growing in research, research delivery, or delivery research leadership, and clinical practitioner academic. So think about which kind of type fits your kind of profile best. And one thing just to say around the application process, we will be the panel will be judging these in those groups. So just to reassure you, if you are a brand new researcher, you won't be being compared potentially to someone who's developing a clinical academic practitioner role. So we will select within those types. So if you feel you have limited experience, that's fine, because you'll be being judged against others who have similar levels of experience. Importantly, think about the activities you might want to undertake as part of your internship. As I said, you may already have some ideas. The application will give you more, and I've mentioned a few of those as well. But if it's research related and you can present a good case, then generally that would be suitable for an application. So see the menu for examples, but also add your own ideas. And this is where talking to others in your organisation might help. So prepare your application. Please do make sure you refer to the guidance for applicants. Partly that should have lots of the answers to any questions you might have. And again, will strengthen your application because it will tell you a little bit more exactly about what we're looking for. So please do refer to that when you're developing your application. If you do have any questions, as Beth said, contact the ARC KSS Academy on the email we've already shown you. and we will provide one-to-one support, answer any questions, or potentially guide you through some of that process should you need it. Next slide, please, Beth. So thank you. So that was a bit of just an overview of what the programme is all about. There may be some people on the call who are managers and are thinking of potentially supporting others in your team to apply for this. Just to say, we do have a managers webinar as well, which is particularly targeting questions that, if you're supporting someone to undertake an internship, is tailored to that as well. So this is the first of two webinars, the second one designed to answer questions for managers if you are supporting interns in this programme. So I think that's everything. So if we can stop sharing, Beth, and
I'll stop. Okay, we've stopped.